Rồi.
Sao mày ngủ đầu sớm vậy không phải kia?
Không.
Rồi cái đầu mà không làm được.
Chứ không thích chơi nữa là nhộn thằng đen.
Hả?
Không thích chơi nữa nhộn đen thôi.
Chơi
Không, da đen lắm.
vậy bố nói gì?
Không.
Mẹ nói gì?
Mẹ bảo mỗi da đen rồi chứ không cái gì.
Sao vậy?
Nhộn dưới quán. 250.
Cái này không bảo dưới à?
Đất này không, đất này có cô ra rồi. Vâng.
Cô ở nhà.
Đó.
Cô ở nhà.
Nhà em.
Ở nhà em luôn à?
Vâng.
Cô với em bố à?
Em bố.
Cô lấy chồng rồi.
Chồng lấy luôn.
Có con mà.
Có mà.
Mấy con.
2.
Con sớm này.
Đi sớm ra còn ra bên ngoại nữa, bên nội dậy đây nữa.
Sớm này đâu?
Ở Đà Nẵng này, Huế.
Bố em có mấy anh em?
Bố em có 3 anh.
Bố thứ mấy?
À bố thứ 3. 4.
Lại một cô nữa.
4 còn ba cô nữa cơ mà.
Nó là nhà 6 anh em.
Vâng. 7 chứ.
Hả?
7.
7 anh em.
4 trai 3 gái.
Nó làm này. Nó làm mẹ nhẹ thôi. À, đâu ấy được.
Trong Huế.
Huế.
Vâng.
Có ai đây không?
Không. Bố em ở đây.
Tao còn.
Bà mất rồi. Anh đợi chị quay YouTube đi. Đợi chị like TikTok, like YouTube đi.
Blackheads, medically called open comedones, form when the opening of a hair follicle, a pore, becomes blocked by a compact mixture of sebum, skin oil, and dead skin cells. The surface of that plug is exposed to air and oxidizes, which makes it look dark, so the color is not dirt. And the most effective prevention is not aggressive scrubbing, frequent squeezing, or constantly chasing quick extractions, but a steady, barrier-friendly routine that keeps the follicle lining shedding normally, keeps oil flowing outward instead of thickening and sticking inside the pore, minimizes irritation and inflammation, and reduces everyday triggers such as friction, occlusion, sweat buildup, hair product residue, and incomplete removal of sunscreen or makeup film. Because comedones develop gradually and clear gradually, prevention is a long game system. Daily habits repeated consistently for weeks and months, rather than an occasional intense reset that strips the skin, causes irritation, and forces you to stop. The first pillar is cleansing done correctly, because blackhead-prone routines usually fail in one of two ways: under-cleansing that leaves film behind, or over-cleansing that strips the barrier. Both can worsen congestion. Under-cleansing leaves sunscreen, long-wear makeup, thicker moisturizers, environmental particles, and sometimes hair product residue on the skin. Those films mix with sebum and dead cells at the pore opening and encourage plugs to compact. Over-cleansing, especially when combined with hot water, harsh detergents, frequent alcohol-based toners, stiff brushes, gritty scrubs, or degreasing cleansers that leave skin squeaky, disrupts barrier function and inflames the pore opening. Irritated skin often sheds less evenly, becomes more reactive to products, and may produce rebound oil in response, creating a loop where the skin feels oily and sensitive at the same time, and pores clog more easily. Every evening, cleanse your face to remove sunscreen, makeup, sweat, excess oil, and daily environmental buildup. Use lukewarm water rather than hot water because heat increases redness and barrier stress. Choose a gentle, fragrance-minimized cleanser that leaves your skin comfortable rather than tight. For oily or combination skin, a mild gel or low-foaming cleanser often removes excess oil without overstripping, while for dry or sensitive skin, a creamy, non-foaming cleanser may be more comfortable and still effective. Massage the cleanser gently with fingertips for about 20 to 30 seconds, focusing on typical blackhead zones such as the nose, sides of the nose, chin, jawline, forehead, and any area that tends to feel bumpy. Then rinse thoroughly. More pressure and more friction do not equal better cleansing, and aggressive rubbing irritates follicles. If you wear makeup or water-resistant sunscreen, add a first step to dissolve the film before your regular cleanser, because stubborn films can trap oil and dead cells at the pore opening and make blackheads more likely. This first step can be an oil cleanser, cleansing balm, or micellar water, followed by your gentle cleanser. The purpose of double cleansing is not to wash harder. It is to remove films efficiently so you do not have to scrub. If you use micellar water, use enough product to dissolve residue, avoid rough rubbing, and follow with a gentle rinse or cleanser to remove leftover surfactants. If you use an oil cleanser or balm, emulsify with water and rinse thoroughly before the second cleanse. Avoid gritty physical exfoliants, stiff cleansing brushes, rough washcloth friction, and frequent alcohol-based toners as routine tools, because repeated micro-irritation around pores inflames follicles and disrupts orderly shedding, which often worsens congestion over time, even if the skin feels extra clean temporarily. In the morning, cleanse if you wake up oily. If you sweat at night, if you used heavier products before bed, or if gentle morning cleansing consistently improves clarity. If your skin is sensitive or easily irritated, a light rinse or very mild cleanse may be enough as long as evening cleansing is thorough and consistent. The second pillar is moisturizing, even if you are oily, because skipping moisturizer often backfires. A dehydrated, compromised barrier becomes more reactive, sheds unevenly, and tolerates effective pore-clearing actives poorly, and reactive skin can clog more easily. Barrier support is not just comfort, it's part of prevention biology, because stable, comfortable skin is more likely to shed normally and tolerate the ingredients that keep pores clear. Choose a lightweight, non-comedogenic moisturizer that supports barrier function and feels breathable. Helpful ingredients include glycerin for hydration, ceramides for barrier lipids, panthenol for soothing support, hyaluronic acid for water-binding hydration, and often niacinamide for barrier resilience and reduction of redness in many people. Apply a thin layer after cleansing, ideally while skin is slightly damp, to reduce water loss. If you get shiny easily, choose gel cream or lotion textures and keep the layer light. Moisturizing should feel comfortable rather than heavy. If you are using actives such as salicylic acid or a retinoid, moisturizer becomes even more important because barrier support improves tolerance and reduces the risk of irritation that can derail consistency. The routine that works is the routine you can keep doing. The third pillar is daily sunscreen. Broad-spectrum SPF 30 or higher reduces UV-driven inflammation and long-term collagen breakdown that can make pores appear more prominent over time. And sunscreen is essential if you use exfoliating acids or retinoids, because these can increase sun sensitivity. Consistent sun protection also helps reduce uneven tone and lingering marks that can make texture look worse, and calmer skin typically tolerates blackhead preventive actives more easily. Apply sunscreen generously. Many adults need roughly 2 finger lengths for face and neck. Spread it evenly and reapply during extended outdoor exposure. If sunscreen feels greasy and makes you want to skip it, try modern lightweight fluid, gel, or oil control formulas until you find one you can use consistently. Consistency matters more than the brand. If you wear makeup, apply sunscreen first, let it set, then apply makeup. At night, remove everything thoroughly. Once the foundation is stable, gentle, cleansing, moisturizer, daily sunscreen, the most effective blackhead prevention tools are evidence-based pore-clearing actives used patiently and correctly at a frequency your skin can tolerate long-term. For most people, the 2 best supported categories are salicylic acid, BHA, and topical retinoids. Salicylic acid is oil-soluble, so it can penetrate into the pore lining and loosen the compact mixture of oil and dead cells that forms comedones. It also helps reduce the stickiness of shedding inside the follicle. For prevention, a leave-on salicylic acid product in the 0.5% to 2% range is a strong choice, but success depends on sustainable frequency rather than maximum strength. Start slowly. Apply it 2 nights per week for the first 2 weeks, then increase to 3 nights per week if your skin remains comfortable, and only move toward every other night if needed and well tolerated. Apply salicylic acid at night to clean completely dry skin. Damp skin can increase stinging. After applying, wait briefly, then moisturize. If you are sensitive, buffer by applying a thin layer of moisturizer first, then salicylic acid, then moisturizer again. Or apply salicylic acid only to blackhead-prone zones like the nose and chin rather than the entire face. Some people prefer a salicylic acid cleanser, which can be gentler because contact time is short. That can be useful for very sensitive skin or for those new to acids. But for stubborn blackheads, a leave-on often works better because it has more time to act inside the pore lining. Retinoids are the other cornerstone because they normalize how skin cells mature and shed inside the follicle, reduce microcomedones, the invisible precursors of blackheads, and improve texture over time. They help prevent new clogs from forming rather than only loosening existing ones. Over-the-counter adapalene 0.1% is commonly used for comedonal acne in many regions. Stronger retinoids may require a prescription depending on where you live. Retinoids work best with a low and slow introduction for the best balance of results and tolerance. Use a pea-sized amount for the entire face, not a pea per area. Applied at night to completely dry skin. Start 2 nights per week for 2 weeks, then 3 nights per week, then every other night, and only if well tolerated, consider nightly use. Using more product does not speed results, it increases irritation. If you are sensitive, use the moisturizer sandwich method. Apply a thin layer of moisturizer, then retinoid, then another thin layer of moisturizer. Mild dryness or flaking during the first few weeks can be normal as the skin adapts, but burning, persistent redness, cracking, or raw tightness means you are going too fast. Reduce frequency, add moisturizer-only nights, and rebuild tolerance gradually. If you plan to use both salicylic acid and a retinoid, do not start them simultaneously and do not layer them on the same night at first. Introduce one active, stabilize tolerance for 3 to 4 weeks, then add the second on alternate nights. A practical early schedule is retinoid on Monday and Thursday, salicylic acid on Tuesday and Friday, and moisturizer only on the remaining nights. Adjust later based on comfort and results. Many people do best with a retinoid as the long-term anchor and salicylic acid as a targeted booster once or twice weekly on the nose and chin. Because this combination addresses both the follicle's shedding pattern, retinoid, and the oily pore environment, BHA, while keeping irritation manageable. Supportive ingredients can improve comfort and consistency, making it easier to stick with prevention long enough to see results. Niacinamide in the 2% to 5% range can support barrier function, reduce redness, and modestly help oil regulation for some people. It is not as directly pore clearing as BHA or retinoids, but it often improves tolerance and reduces the urge to overcorrect when skin feels slightly dry. Azelaic acid can help with inflammation and uneven tone, and may help mild comedonal acne. Many people with sensitive skin tolerate it well, and it can be used once daily or several times per week, depending on comfort. If you also experience inflammatory pimples along with blackheads, benzoyl peroxide can reduce inflammatory lesions, but it is less direct for blackheads than BHA and retinoids. If you use benzoyl peroxide, consider a cleanser form a few times per week or targeted use. Introduce it slowly, monitor dryness, and avoid stacking too many strong actives at once while your barrier is adjusting. Overloading the routine is one of the most common reasons prevention fails. Physical exfoliation scrubs, gritty cleansers, abrasive brushes often creates microtears and inflammation. It may feel smooth temporarily, but it can worsen sensitivity and congestion over time. Chemical exfoliation is more predictable, but it must still be measured. Overexfoliation disrupts the barrier and causes stinging, redness, scaling, and increased reactivity. Irritated skin often clogs more easily and tolerates fewer effective nights of treatment, slowing progress. Use comfort as your guide. Your skin should feel mostly calm on most days. If moisturizer stings, if you feel persistently tight or raw, or if redness remains for days, scale back. Pause actives for several days. Use gentle cleanser and moisturizer only, then restart at a lower frequency. Prevention should feel sustainable, not like a constant battle. Beyond products, blackhead prevention depends heavily on managing friction, occlusion, and sweat. because anything that traps heat, sweat, and oil against the skin can worsen clogged pores. Prolonged mask wear, helmet straps, chin straps, tight collars, repetitive rubbing, and heavy, occlusive products used in the wrong areas. You do not need to avoid protective gear. Manage the environment. After prolonged mask or strap wear, cleanse when possible, apply a light moisturizer to reduce friction, and avoid heavy ointments in areas under constant contact. Keep masks and straps clean. Sweat can increase congestion. If you sweat heavily due to exercise or climate, rinse or cleanse soon afterward, then reapply a light moisturizer and sunscreen if it is daytime. Hair products are a common hidden trigger, especially along the forehead and temples. Pomades, heavy oils, waxes, and leave-in conditioners can migrate onto facial skin and clog pores. If you notice blackheads along the hairline, switch to lighter hair products, keep them off facial skin, and wash the hairline and forehead thoroughly at night. Avoid oily bangs resting on the forehead. Everyday contact surfaces matter too. Pillowcases collect oil, skincare residue, and hair product film. Change them at least once or twice per week, more often if you are very oily or use heavy hair products at night. Clean your phone screen regularly. Wash makeup brushes and sponges weekly because they accumulate oil and product residue that can transfer back to skin. If you use reusable cloths, wash them frequently and avoid reusing the same cloth repeatedly without laundering. These habits do not replace effective actives, but they reduce the background load that keeps pores congested and makes blackheads more stubborn. Product selection matters too, but it should be practical, not fear-based. Non-comedogenic labeling can help, but it is not a perfect guarantee because individuals vary. Use simple rules. Prefer lighter textures, fluids, gels, lotions on acne-prone zones. Avoid layering multiple heavy products on the T-zone. Remove sunscreen and makeup thoroughly every night. And introduce new products one at a time so you can identify triggers. If you start a new product and blackheads gradually increase after 2 to 4 weeks, stop it and reassess. Keep your routine stable enough to identify what helps, rather than constantly guessing. Also consider that not everything that looks like a blackhead is a true open comedone. Many people notice tiny dots on the nose and assume they are blackheads, but some are sebaceous filaments, normal structures that represent oil within the pore lining. They can look like small grayish dots and refill quickly after extraction. The prevention approach overlaps gentle cleansing, BHA, retinoids, sunscreen, but expectations should be realistic. Sebaceous filaments can look less obvious with consistent care, but they do not disappear permanently. True blackheads tend to be darker, more defined, and persist longer without refilling within a day or two. Understanding this difference helps you avoid over-treating your nose with aggressive strips and scrubs, which often leads to irritation and more visible pores. Avoid squeezing and picking because trauma is one of the fastest ways to turn a manageable blackhead problem into persistent inflammation and marks. Squeezing can push the plug deeper, injure the pore wall, spread inflammation, and increase the risk of long-lasting redness or dark marks. Repeated trauma can make pores look more prominent over time. If you tend to pick, create barriers, keep nails short, avoid magnifying mirrors, limit skin checking to once daily in normal lighting, and consider covering frequently touched areas with a simple patch to reduce contact. If a blackhead truly bothers you, professional extraction by a trained clinician or qualified professional can remove it with less trauma. But extraction alone does not prevent recurrence. Maintenance with BHA and/or retinoids prevents new plugs from forming. Be cautious with pore strips and aggressive peel-off masks. They can temporarily remove superficial plugs, especially on the nose, but they often do not address deeper microcomedones and can irritate the skin, leading to rebound congestion. If you use them rarely and gently, and do not treat them as your primary prevention strategy. Clay masks can help very oily skin by absorbing surface oil and reducing shine. Once weekly can be reasonable, but overuse can dry and irritate the barrier, so moisturize afterward and keep other actives gentle that day. To keep prevention straightforward, follow a simple structure you can repeat consistently. In the morning, cleanse if needed, apply a light moisturizer if you feel tight, and apply broad-spectrum SPF 30+ generously. In the evening, remove sunscreen and makeup thoroughly double. Cleanse if needed. Cleanse gently. Apply your active on designated nights, then moisturize. If you are new to actives, choose one first, either salicylic acid, leave on 2 nights per week, or adapalene 2 nights per week. Then build tolerance before adding anything else. After 3 to 4 weeks of good tolerance, increase frequency gradually and consider adding the complementary active on alternate nights if needed. Keep everything else simple, because the more complicated you make your routine, the easier it becomes to lose consistency, and consistency is the engine of results. It is also helpful to know what progress should look like, so you do not abandon an effective routine too early. Early improvement often shows up as smoother feel, less filled look to pores, and fewer new clogs appearing in the same hotspots. Visible blackheads often improve more clearly after 8 to 12 weeks of consistent BHA and/or retinoid use, and maximum texture improvement can take several months. If you stop and restart frequently, the follicle environment never stabilizes long enough to show its full improvement. If you are not seeing progress by 8 to 12 weeks, the most common issues are incomplete nighttime removal of sunscreen or makeup, using actives too infrequently to matter, using actives too aggressively, and causing irritation, which disrupts the barrier and increases reactivity, using heavy, occlusive products in blackhead-prone zones, or ongoing friction and sweat without timely cleansing. In troubleshooting, simplify and stabilize first. Confirm you are cleansing properly at night, moisturizing to support the barrier, wearing sunscreen daily, and using your active with a frequency your skin can tolerate. If irritation is present, burning, persistent redness, peeling that does not settle, reduce active frequency, and focus on barrier support. Then rebuild slowly. If blackheads persist without irritation, increase frequency gradually, or add the complementary active on alternate nights. Diet and lifestyle can support prevention in some people, though response varies. High glycemic patterns, frequent sugary drinks, candies, pastries, refined carbohydrates can worsen acne in some individuals through hormonal and inflammatory pathways that influence sebum and follicle behavior. If you suspect a link, reduce high glycemic foods and sugary drinks consistently for 6 to 8 weeks while keeping skincare stable, and observe the overall trend rather than day-to-day fluctuations. Some people notice a relationship between dairy, especially skim milk, and acne. Evidence is mixed and individual, but a calm, controlled personal experiment can be reasonable if done consistently. Sleep and stress management support skin by reducing inflammation and reducing habits like touching, picking, and skipping routines. Aim for regular